What's up, everybody? Welcome in AtoZ Sports Doc Talk back for another segment because we have another significant Titans injury to discuss as the reports came out about Titans rookie wide receiver Treylon Burks and the turf toe that he sustained. What exactly is turf toe? And if you could take us through that, that would be great.
A turf toe is basically a sprain of the big toe, the joint at the base of your big toe. And if you can see this little model here, your ankle's back here, your forefoot out here, your big toe. But a turf toe is basically taking your big toe joint and hyperextending it or bringing it toward the nail or up a lot further than it's supposed to go. It's a common injury you'll see in football because when a player gets his foot planted or somebody lands on the back of his heel, if his foot's resting on the ground, that toe gets taken through a range of motion that's way beyond its comfort level, and the ligaments, which connect bone to bone, get sprained or stretched out. Turf toe got its name basically from playing on artificial turf. The way back with the Astrodome, that's where you started seeing these kind of injuries. The reason they occur a little more easily on a turf field is because the shoes the players are wearing are a lot more flexible. Their cleats are kind of molded into the sole of their foot instead of being screwed into a plate like they would on a grass field. And so the shoe is a lot more flexible, and it gives that toe a lot more opportunity to get taken through a range of motion it's not ready for.
Are there different grades of it? And take us through those different levels.
Yeah, there are grades. So we grade a turf toe injury, a grade 1, a grade 2, and a grade 3, 1 being the mildest, 3 being the most severe. Grade 1 is where you stretch the ligaments, but you don't really tear them. 2, you have a little more injury and some tearing of the ligaments, but the joint is still nice and stable, but just more injured. And then a grade 3, a lot of times you're actually tearing the ligaments completely. You could even fracture a bone. The toe could be dislocated. 3s are obviously really severe injuries. It doesn't sound like, from what we hear, that Treylon had that type of injury. Even a grade 1 may keep you out of play for a week or 2 or 3. Grade 2s maybe 3 to 6 weeks, depending on how quickly they respond to therapy and treatment. But it sounds like his was a more mild 1 or 2 type of injury.
So what are some things that an athlete would do and try to get themselves back with that injury?
So the first thing you do is put the player in a boot. The boot basically prevents the toe from having to move. You can walk on it, but rest it at the same time. So I think I heard that even after he came out of the locker room after that injury, he had a boot on, which is appropriate.
And crutches. Boot and crutches.
So you just have to let pain kind of be your guide. Even in the boot, it can be tender. Ice is, the typical injuries, treatment for a sprain or rest, ice, compression, elevation. So they call it the RICE therapy. Therapy-wise, you can do some ultrasound, or we call it ionto or phonophoresis, are called modalities, trying to minimize swelling, milking down the toe with a little compression. Taping, the best thing you do in therapy is as you start to rehab and recover, you tape the toe so it can't extend as much. You tape it down so it tries to limit the extension and try to minimize recurrent injury to the toe. And then as you progress back to a shoe, a lot of times we're putting a stiffening device in the shoe called a turf toe insert. Basically, it's trying to stiffen the toe of the shoe and minimize some of the motion of the big toe.
Sometimes injuries, you have them and it's more of a pain management, but this does, you think it could affect the actual ability of the athlete to make these cuts and make these moves if it's not fully healed?
Yeah, because there's such a demand on your big toe. Your big toe is a stabilizer for your balance. It's a stabilizer for strength. It's a major force in your foot for pushing off and making a cut. And so it really depends on how comfortable he is. I mean, they'll use ways of trying to minimize some of that, but not cancel it out, because you need that kind of that feedback sensation to tell you if you're doing too much or too little. But it can definitely linger for a while longer than people would think, and it can actually affect performance and for a while until he gets more confident with it.
If Treylon Burks is going to be in a boot for the next little bit, and what are some ways that an athlete like a wide receiver can try to keep their cardio conditioning up to a high level to where they don't have to get back into game shape once their toe feels better?
Yeah, so even at this point in a boot, he could be riding a stationary bike or getting in a pool and kind of running in the water, or doing things to maintain his cardiovascular conditioning without creating new injury to his toe or aggravating his toe. But we can cross train and do a lot of activities that won't aggravate his foot, but still maintain his conditioning.
Great stuff. We always learn a lot when we talk to anybody at the Bone and Joint Institute. So Dr. Derr, foot and ankle specialist there at the Bone and Joint Institute. If you get hurt in any type of way, whether it's playing sports, your kids playing sports, or just walking on the steps, or however it looks, injuries happen in life, and the people at the Bone and Joint Institute are always there to take care of you. Dr. Derr, thanks again for the time, and I hope you guys have a great rest of the week, and thanks for jumping on short notice.
Yeah, appreciate it. Thank you.
All right.